You are listening to the Body Charge podcast, and I'm your host, Sandy Sanderson. Welcome to the Body Charge podcast. Today's topic is, what do thyroid problems and autoimmune conditions have in common? Autoimmune thyroid diseases are the most prevalent organ-specific autoimmune diseases affecting about 5% of the population. They include Graves' disease and Hashimoto thyroiditis, among others, and reflect the loss of immunological tolerance. My special guest today is Dr. Kevin Smith, a board-certified functional medicine practitioner who has been in practice since 2001. In addition to clinical practice at Integrated Thyroid, he's also a public speaker and published author. His second book, in functional medicine, is scheduled to be released later this year. So welcome aboard, Dr. Kevin. Glad to have you on the Body Charge podcast.
Thank you very much for having me. It's an honor.
My first question is, what is the connection between the immune system, the thyroid, and metabolism? How do these things relate to one another?
Okay, so first of all, the thyroid gland is a small butterfly-shaped endocrine gland that is located in the front of your neck, right above that little notch in your neck. And the job of the thyroid gland is to control how much energy that your body produces while it's at rest. So it's kind of like an accelerator pedal in a car. If you press on the accelerator pedal, the car is going to go faster. If you take your foot off of the gas, the car is going to slow down or it's going to come to a standstill. The same thing happens in your body. Every single cell, all 70 trillion cells in your body, has on it a receptor site for thyroid hormone. So if the cell is in the brain, if it's a neuron in the brain, and you cannot deliver a sufficient amount of thyroid hormone, that person is going to suffer from things like brain fog, or they're going to have depression or anxiety or nervousness or irritability, or they may suffer from memory loss, cognition issues. They may suffer from all kinds of neurological issues. If it's affecting the gut, then that person may experience GI problems, such as constipation, diarrhea, poor absorption of food. If it affects the reproductive organs, and let's say it's a woman of childbearing years, she may suffer from infertility or an abnormal menses. So every single cell in the body could be affected by low thyroid disease. Now, the other question that you had asked is, what is the relationship between autoimmunity and thyroid disease? According to the Academy of Endocrinology, 90% of all cases involving hypothyroidism has a component in it called Hashimoto's disease. So that means 9 out of 10 people that have low thyroid have an autoimmune problem. So it's not an endocrine problem with Hashimoto's, it's an immune system problem. So what's going on here with autoimmune disease? The immune system is the body's defense system. It's supposed to be circulating throughout your body and trying to protect you from bacteria or viruses or a
Toxins?
parasite, toxins or a parasite or something. And so what happens with autoimmune disease is that same defense mechanism starts to attack your own body. And there's 100 different autoimmune diseases, and they're specifically named based on which body part is being affected. If the immune system is attacking and destroying the thyroid gland, that's called Hashimoto's disease. And it's a very prevalent problem. Most medical doctors in the United States and in Europe don't even test for it. And even if they did, it wouldn't change their treatment plan. So it's kind of a medical failure. That's not one of those things that medical doctors never fix. Um,
And it's so
there's
prevalent.
it's very, very prevalent. In the United States, there are 30 million cases of thyroid disease alone, and that doesn't take into consideration Australia or Asia or Europe, all these different places. Inside the United States, the number one cause of low thyroid disease is Hashimoto's. Outside of the United States, it could be due to low iodine problems, iodine deficiency. That's not really a problem in developed countries like the US or Australia or Europe because they put iodized salt on everything and we get a ton of iodine from that iodized salt. So it's due to a problem involving the immune system.
Yep. Or we can eat seaweed sheets, seaweed
Exactly.
snacks.
Exactly.
So I had Hashimoto's myself back in 2007, and it was as a response to severe stress. And I had to work sometimes round the clock, 24 hours without sleep to get to print on time in my previous job. And so that was the biggest stress on my body. It really affected my adrenals. I developed severe heart arrhythmias. And one day they rushed me to hospital thinking I was having a heart attack because your body goes into a panic when the heart rhythm is not stable. And, I was gripped with fear and that kind of made it all worse. But they put me through the testing. My blood vessels were clear. The heart muscle was functional. It was in good condition. So the cardiologist said, "Oh, well, just put up with it like everyone else. All you've got is a twitch in the left ventricle of your heart muscle. And it's like a twitch in the eye or a cramp in the leg. Just put up with it like everyone else." He said, "You'd be amazed how many other people have this problem." So I went home. I was not satisfied with that result, although it was good that there were no drugs or surgery at that time that he could recommend. He said, because your blood pressure is so low, if we give you a drug to slow the heart, you'd have a heart attack. You could have a heart attack. So I did my own research online, and a lot of the symptoms led me to magnesium. So because my digestive system, as you had said, was affected, I couldn't digest food properly, even though I was on a healthy, fresh food, good diet with lots of variation, meat and veg. But I wasn't absorbing. I wasn't digesting and absorbing. So through the stress, I'd lost a lot of magnesium, but I was able to put it back through soaking, through using the skin, which led me to my current business, Elektra Magnesium. So transdermal magnesium worked very well for me in that condition. So I can control any of those symptoms simply by daily supply of enough magnesium. So not everyone would be, they might have other problems, but magnesium is a very large part of that immune dysregulation. So my next question is, why does stress affect the immune system so adversely?
Well, the first of all, when you have an immune system problem, such as autoimmunity, nobody really knows exactly what causes it. Researchers have theorized that it could have a genetic link. They have also theorized that it could be due to a life effect, such as the birth of a baby, a marriage, pregnancy, the death of a parent, the death of a spouse, a move, a new job or a new career, something that's very, very stressful for a lot of people. And they haven't really come up with a clean explanation about what is going on with that. Um, when you have a lot of stress going on, your adrenal glands, which are small triangular glands that sit above your kidneys in your lower back, they produce a bunch of different stress hormones. One of those hormones is called cortisol, and cortisol can affect your body's auto the fight or flight response. So you either fight a stressor or you flee. And the thing is, when the stress is over, when the danger is away from you, things should go back to normal again. But sometimes people have problems where it doesn't go back to normal. It stays raised, stays
It
elevated.
gets stuck. The adrenals
Yes,
get stuck. Because I remember I was just often just sitting there. It was calm, relaxed. There was no stressful stimulants, and yet I could feel the blood racing and the heart going faster, and I could feel that adrenaline. And I'm thinking, there's nothing stressful in my environment. I don't have stressful thoughts. What is going on with my body?
so it's a problem involving the autonomic nervous system. That's the sympathetic and parasympathetic divisions of the nervous system, which can be regulated by your adrenal glands through the endocrine system. And what's going on with that is has a relationship to inflammation in the body. And when you have inflammation, there's two types of inflammation. There's acute inflammation and chronic inflammation. Acute inflammation is when you're riding a bicycle and you fall off and you bump your knee on the sidewalk. It gets red, it swells, it hurts, and it generates heat. And that's normal. That's a normal, healthy response to a trauma or maybe to an infection, and that sets the stage for healing and repair by your body. But if that happens and then something it turns off the shut off switch and it just keeps going and going and going and going, that is very bad. That's called chronic inflammation. And chronic inflammation, according to the scientific literature, has been linked to almost every single pathology that we know about. And when you have a lot of stress and it's unchecked inflammation, that's like putting a blowtorch on your cells. And if it affects the heart, it can cause tachycardia or the heart to speed up or slow down or have an arrhythmia or some other type of problem.
Because the adrenaline and the cortisol are there for the fight or flight. It's there to protect you in case, you need to escape danger or you need to compete in an athletic event or whatever the event is, you need all that energy for to make your muscles work. But as you said, there's no recovery phase in autoimmunity. We're constantly irritated and subjected to that um, adrenaline, the stress hormone stimulus. It doesn't give us a rest. Is that right? Doesn't give
Yes,
recovery.
when you have a autoimmune condition, you cannot turn it off. You can't flip a switch and turn the whole thing off. Once you have an autoimmune disease, you have it for the rest of your life. It's part of your genetic profile. However, you can put it into remission, which means it's no longer causing mischief. It's no longer triggering these symptoms
You can manage it.
yeah, exactly. So you seem to have found different mechanisms of managing this problem, which is commendable. And before you even said transdermal, I was thinking, boy, I wonder if this is transdermal.
Yeah,
So you can just bypass the whole gut and go directly
yeah,
into the bloodstream
yeah.
that way. So that's phenomenal.
Yes.
Um, there's a relationship that exists between the gut and the thyroid. The gut has is the gateway where autoimmunity largely starts. It largely starts through a condition called leaky gut syndrome. Another word for that is um, antigenic. Um, I forget what the word is. It basically it's like this. Your small intestine is where you absorb your food, and think of it like a long pipe, about 21 feet long. And on the inside of that pipe, you have finger-like projections that stick out from the pipe. They're called villi, and they increase the surface area of this small intestine. And as the bolus of food brushes past the finger-like projections, they absorb nutrients, macronutrients like carbohydrates, proteins, and fats, and micronutrients like vitamins and minerals. Under normal circumstances, that's how absorption takes place. When you have a leaky gut problem, the cell walls of the gut start to open up. Think of like elevator doors opening. And when that happens, the food particles can bypass the normal cells and go directly into your bloodstream. And the body doesn't know what that is. It doesn't know what to make of it.
It's a
So it
foreign
starts
protein.
attacking. It starts attacking it,
Mm.
whether it's a dipeptide, a tripeptide, 4 particles, 5 particles, 17 particles. The body starts attacking it, and that revs up the immune system. And when you have a person with has leaky gut, they can have bloating, gas, distension, abdominal cramping, abdominal pain. They can also have a problem with a porous blood-brain barrier. So they have leaky brain. So
Yeah.
things can go into the blood-brain barrier and mess up your brain.
That's another membrane.
Yeah, so the body, the gut and the brain have a relationship. The gut is thought to be your body's second brain. That's where a lot of your neurotransmitters are made. That's where 80% of your immune system is. Your ability to manufacture serotonin, dopamine, things like that, it's in the gut.
And the
So
immune
you
system as well, isn't it? The immune
have,
system lives in the gut.
yeah, you have the MALT, the mucosa acquired lymphatic tissue, and the GALT, the gut acquired lymphatic tissue. And it's very, very powerful in your immune system. So if you have a sick gut, you're not going to be at your best. You can't be healthy all the time. And so by applying transdermal creams, you bypass the whole mechanism and go directly to the bloodstream. So that's great thinking on your end.
Yes, because the cells, the tissue cells of the muscle and the bone hold about 99% of the whole of the body's magnesium reserves. And it's
Mm.
like a safety, it's like a bank account, a savings account. So if we've been under a lot of stress, this is from my readings of the research, the levels go lower and lower, especially as we age. We can't refill that tank like we used to. And it gets to a certain level in the reserves where, symptoms emerge. And then it takes a while to fill up those reserves again, but they do fill up, for people who have these issues, stay hopeful because there's a way through. Um, and having optimal reserves when you are under stress, you have plenty of resources available to cope. So as you build magnesium reserves, you feel, oh, I felt much stronger on the inside. I wasn't so fragile. I could handle stress and deal with it, and my brain wasn't foggy. So I had solutions and I just went through, whatever's needed, get it done. I had a much more resilient internal perspective on everything. And so I think this is fundamental also to the immune system, isn't it? So if you have brain fog and you can't see solutions, your anxiety levels go up. You really don't know what to do. You feel under threat or in danger, or something's about to happen. You can get even paranoid. Well, that didn't happen to me, but it happens to a lot of people, and then they can be caught up with a mental health analysis when the fundamental underlying problem is not enough nutritional resources to supply their metabolism and their brain and, whatever's needed in the body.
Yeah, I agree. So I think that the way that it's determined in functional medicine, my field, is to do some lab tests. So we could take an objective measurement about what the level would be circulating throughout the body. So to take a measurement is to be very, very objective about this. It's not like how you feel or what
Yeah.
kind of symptoms that you're having. It's based completely on objectivity. So I would order lab tests such as blood, urine, stool, or saliva, and look at what am I looking for?
Thyroid
Um,
levels?
yeah, like when medical doctors check your thyroid, typically they'll order one test. They'll order a TSH test. I order 10 tests because I want to see the entire metabolic
The
landscape.
big
I
picture.
want to see, yeah, the big picture. I want to see the function of the liver, the function of the gut, function of the brain, function of the thyroid gland itself, and see exactly what's going on, see if it's being transported from place to place correctly. Um, you can make plenty of thyroid hormone, and you could have a problem converting it. So there's two thyroid hormones that's produced by your gland, by the thyroid gland. There's T4 and there's T3. T4 has four iodine molecules attached to it. T3 has three iodine molecules attached to it. Now, 94% of all the hormone that comes out of the thyroid gland is T4. Only 7% is T3. However, T3 is the active form of thyroid hormone. It's the kind that your body wants to use
Get
for all the different cells.
gets into
So,
cells. Yeah,
yeah, so what the body wants to do is it wants to convert T4 into T3, and that takes place first in your liver and second in your gut. And so you have to have a healthy liver and you have to have a healthy gut for
right.
that to take place. And if either one of them is sick or not working right, you're going to have a problem converting this. So there's a lot of places where it can go wrong. And medical doctors don't look at all the different pieces and parts like they should. And as a result, these problems stay undiagnosed or misdiagnosed. And only 17% of people that take thyroid hormone are going to get better. The other 83% are never going to get better.
Or they may be prescribed sedative medications to help them sleep better because they can't get rid of the stress and the inflammation, the anxiety. And then those chemicals in the medications have another set of side effects, which can further hinder thyroid function. So people can get caught in a downward spiral of
Well, the
polypharmacy.
the yeah, I agree 100%. The medical doctor, there's two broad categories of care in the world. There's allopathic medicine, which is what medical doctors do in your country and in my country, and then there is functional medicine. Here's the difference. When you have a certain symptom or a certain problem, you go to see the medical doctor. He puts you in a certain diagnostic box, and if you're in that diagnostic box, he gives you these drugs to chase after those symptoms. That's what the medical doctors do. They don't cure anything. They manage problems. The functional medicine doctor asks the question, why? Why do you have these symptoms? What's going on in your body? The medical doctors don't ask that question. They don't care. They just say, you have these symptoms, take this drug, I'll see you in 6 months. The functional medicine doctor has to do a little bit of detective work and find out exactly what is causing that. Why do you have high blood pressure? Why do you have low thyroid? Why do you have um, arrhythmia, heart arrhythmias?
And what's the
So
connection?
So when I look at thyroid, first of all, I look at the immune system component, like we talked about before, and then there are nine different triggers that I look at. And so I need to identify these triggers, and they are things like anemia, blood sugar dysregulation, cortisol problems, sex hormone problems. That would be include estrogen, progesterone, testosterone. Remember, boys and girls make both, and they have to be in the right amount for the right gender and the right age. There's chronic inflammation, there's oxidative stress, there's GI problems, food sensitivities, chemical sensitivities, and um, undiagnosed viral infections, such as Epstein-Barr virus or cytomegalovirus or herpes. All of those all of those triggers can inadvertently cause problems with your thyroid gland. The medical doctor does not look at all the possible scenarios. So you're missing a ton of information. And that's one of the reasons why medical doctors have a very poor track record of success at helping people that have thyroid problems.
And
Maybe it's
sometimes
due to
it's a catch 22 sometimes, isn't it? Because underperforming thyroid creates a weaker immune system because it doesn't have enough revving from the pedal, from the gas pedal. And so the weaker immune system means that more viral activity can happen and keep triggering the inflammation in the immune system, which takes up a lot of resources and energy and prevents the body from getting over the line to resolve the issue back to wellness. Yeah, sorry
exactly.
to interrupt. Keep going.
No, 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 that you're exactly correct. There's a two-way street that occurs between thyroid function and say gut, thyroid function and brain, thyroid function and sex hormones. So all these things have to have a sufficient amount of thyroid hormone, but they also need to be present in the right amount to not to peripherally throw the physiology off. So I order a ton of tests. Like one of the problems that occurs with this, one of the reasons why this is occurring is when you go to see a medical doctor in my country, when you walk in the door, you tell them what's going on. Before you even walked in the door, your treatment plan has already been predetermined by an actuary that works for the insurance company that sits in a cubicle across the country, who's never met you, has never looked at your chart, has never looked at your labs, has never done an exam, but yet that person is in the driver's seat, not the doctor. And the so they're going to do exactly whatever the insurance company says that they will pay for and nothing else.
Sounds like
And that's
AI.
yeah, exactly. So it's people are very frustrated because
Yeah.
they're not getting the care that they need. The medical doctors are being given their marching orders by the insurance companies, and they're very frustrated. They go to school for a long time to learn how the body works, and they can't even apply that because of money and because of politics and all these things that go into taking place. So when somebody calls my office and they'll say, the first thing out of their mouth is, "Do you take my insurance?" I say, well, there's tens of thousands of different insurance plans, but that's actually the wrong question to ask me. The right question to ask me is, can you help me?
Yeah.
Can you make a magnificent change in my life? Because you know what, if I can't help them, what difference does it make?
What's important, you might get your drugs covered and not have to pay for them, but are they appropriate and are they actually helping you is the big question. And how valuable is your health and your functional capacity in life to do what you need to do, to experience life, to be, joyful and well and healthy and fit? How valuable is that? How much are you willing to pay to get that? And how much are you willing to avoid? Um, an early, premature aging and death. And often it becomes very painful if things have been ignored over time and not resolved. It can really weigh you down. So
Exactly.
it's important, this self-care aspect, this environment determines everything, the internal environment of the body, how we treat ourselves, how what we supply, avoiding toxins and chemicals. We need the whole package to work. So in your cl clinical experience with people, you first of all you find out what's going on, you do the tests and get a profile and get to see who is in front of you, get to see them as real people, what's going on. And then you work out what holes there are, what gaps there are that need to be filled, right? What does the body need? What,
Right.
yeah. So what,
So
give us
so
a
so
typical
I go
scenario.
so I oftentimes will go back to the fundamentals. I'll go back to the basics. Um, Proper nutrition, proper exercise, getting sufficient amount of sleep, managing their stress either through meditation or some other means, maintaining a good their nervous system or their posture through chiropractic care, or drinking plenty of water, making sure that they're well hydrated.
That's a big one.
All of these things are super important, and yet they're so overlooked. And that's the first place I'll start. I will use professional grade supplements to balance the equation. Nobody's diet is perfect 100% of the time. And so supplements are there to fill a gap. And so to help them
But
out, just
sometimes
supplement.
people can be on too high carbohydrates, which because of the sugars become acidic, and the acids kind of weigh you down because the body has trouble adjusting the pH to the proper level for energy, for metabolism. So I think the biggest thing with diet with people is to first of all look at how many carbohydrates are you consuming. Makes a
Exactly.
big difference.
So I when it comes to the macronutrients, carbohydrates, proteins, and fats, I I kind of use the analogy. I use a lot of analogies to get my point home. And knowing what kind of macronutrient to use is kind of like knowing what kind of wood that you would use to make a campfire. So little twigs, kindling, things like that that start the fire, those are the carbohydrates. They burn very quickly, and then they're gone, and then they're hungry again. Proteins are more like wrist size, wrist thick sticks that you put on the fire after it's been going for a while. And then fats are like the big logs that you would put on the fire after it's been established for a couple of hours. That's why if you eat Chinese food, you're hungry again in like an hour because you
Yeah.
eat nothing but broccoli and rice. Whereas if you eat a really heavy, fatty meal, like an Italian meal or something, you're good for a couple of hours because it's going to burn very slow in your
Or
body.
longer. I found that because my digestive system had become so hypo motile, it was very slow and sluggish and constantly constipated. I needed to reduce my carbohydrates because I was always told for my whole life, oh, more fiber, you need. So I was eating lots of salads and lots of really, good vegetable matter, but it was out of balance, and that was actually clogging up my digestive system and getting stuck in a very slow system. So,
Yeah.
yeah,
So
and
so
everyone's different and genetically as well, and that has to be taken into account.
yeah, people that have abnormal bowel transit times that have either constipation or the opposite, diarrhea, or it could ping pong back and forth. That's very, very common when you have a person that has a thyroid issue, and they're miserable. They can't go to the bathroom for like a week at a time, and then they have a lot of diarrhea, and there's no rhyme or reason to it. So they have to rely on laxatives or over-the-counter medications like magnesium uh, citrate, and to try to it's like removing the clog.
Yeah,
Um,
I
there's a
found
lot of different strategies that people can do to bring order and control back into the gut.
I found when I increased my fat content in my meals, things got better and more slippery. Um,
Yeah,
so obviously when I changed the balance of the food components, things improved. So this is probably fundamental in what you do with people, um, to try and adjust the balance of the food that they eat. And sometimes they can have digestive aids. such as hydrochloric acid or enzymes to help stomach digestion, because that's one of the things that fails with the hypothyroid condition, its ability to fully digest the food in the stomach. And so, yeah.
I agree with you. One thing I want to point out is that when it comes to nutrition, there is no one size fits all. So just because a diet would work for one person does not necessarily mean that it's going to work for everyone. So there's a lot of diets out there. There is the autoimmune paleo diet, which I'll very often start with. There is a Mediterranean diet. There's a carnivore diet. There's a ketogenic diet. There's a DASH diet. There's all kinds of different things, and they all, want to try to play around with the levels of the macronutrients. So when I'm talking to people in the office or on Zoom, one of the things that I'm very, very concerned about is what are you eating and where did it come from? They say, well, I want to avoid carbs. Well, a, a, a piece of broccoli is a carb and a Twinkie is a carb.
They're not
So
all the same.
they're not all the same, no.
Hmm.
And so the same thing with fats. Are you eating healthy fats
Or
like
sick,
olive oil or walnuts, or are you eating Crisco and trans fats and margarine?
oxidized fats. Yeah.
Oxidized fats, exactly. So we have to be very
Yep.
careful with our choices.
We're coming to the end shortly. So if you'd like to just add a little bit to summarize and give people a contact for where they can find you.
Sure. Okay. So um, if you have a weird medical situation, there's something that has not been resolved to your satisfaction, you owe it to yourself to give functional medicine a try. That's not the predominant form of healthcare. The predominant one is allopathic healthcare, where the doctors will use drugs to chase after symptoms. Whereas functional medicine is more involved. It does require us to take a deeper look inside your body and see what's going on. To get a hold of me, you can reach me at metabolicsolutions.net. Make sure it's not .com, it's .net. So metabolicsolutions.net. If you live in the States, you can give me a call at area code 412-595-7332. And pretty much what I would suggest for us is to start off by doing a free discovery call. And this is a 10 to 15 minute phone conversation where or over Zoom, whatever's the most comfortable.
I hope you liked this conversation and will share it with others. Let me know what you thought about it in the comments below. If you want to listen to other Body Charge conversations, click like, subscribe, the bell icon, and click all notifications. Subscribe to our newsletter to get updates on blogs, podcasts, videos, and magnesium special offers at electramagnesium.com.au. Relax, recharge, and recover.